under this government, healthcare services in our province are at a breaking point. The number of emergency room closures is up. The wait list for diagnostics is up. The wait times for surgeries is up. At 2.5 million people, the number of Ontarians without a family doctor is up. And as thousands of doctors look to retire, that number is set to go up by another 3 million people. But wait, Madam Speaker, that's not all. Government tax collection is up. No government in the history of Ontario has ever collected more income tax and more sales tax than this one. It truly makes the Premier the taxman, Madam Speaker. Meanwhile, he votes against every common-sense Liberal proposal to cut taxes in this legislature. If the Premier is collecting more taxes than any other in history, and there are so many healthcare failures on his watch, where is all the money going?
Back to the member for Essex.
Speaker, we must always remember the Liberal non-record on health care. They trained fewer doctors. They trained fewer nurses. They did not invest in the public health care system. In fact, according to George Smitherman, the former Liberal Minister of Health, they slashed spending to the health care system in Ontario. By contrast, this government is training more doctors than ever before. We are training more nurses than ever before. We have launched a rebuild or new build of 50 new hospitals across the province of Ontario in every area of Ontario, and we are specifically investing in the Northern Ontario School of Medicine, making sure that we get more doctors in Northern Ontario. We believe in the public health care system, and that, Madam Speaker, is why we are investing in the public health care system.
Question. I recognize the member for Orleans.
Well, thank you, Madam Speaker. We know that this Premier's high-spending, high-tax approach is nothing new. While he was on Toronto City Council, taxes went up 3 straight years, Madam Speaker. His failure to deliver middle-class tax relief, his failure to keep emergency rooms open, and his failure to get people a family doctor, all of these failures are outdone by the Premier's failure to get people in Ontario working. 130,000 more people are unemployed today than the day the Premier was elected. The unemployment rate has gone from 5.9% to 6.8%. Ontario has lost 28,000 construction jobs and lost 8,400 manufacturing jobs in the last 12 months, all while BC, Alberta, and Quebec see job growth. With high spending and high debt and high taxes, why is this government having such a hard time with the essentials like health care and getting people working?
Response. I recognize the Minister of Finance.
Okay. Thank you. Mr. Speaker, Madam Speaker, you know, one of the things is that almost 200,000 new jobs have been created this year. He's taking a little bit of statistic and extrapolating 200,000 new jobs, an economy that's growing. When we took over, $800 billion, now $1.13 trillion. Economy and revenues are growing. And where's the money going? The money's going $50 billion for new hospitals because they built no hospitals. Money to hire more nurses and doctors because they cut nurses, Mr. Speaker. Medical schools, 3 new medical schools, they cut funding for medical students, Mr. Speaker. Madam Speaker, we're growing the economy, we're investing in health care, we've got the job under wraps, and we're going to continue doing it, and they have to stop ignoring the facts, Mr. Speaker. Madam